This multivitamin and iron tablet is used to address vitamin deficiency caused by a lack of nutrients in your diet, certain medical conditions, or during pregnancy. Vitamins and iron are essential for the body and are crucial for maintaining good health. It is important to take this medication as directed to ensure you receive the proper dosage of essential nutrients. It is best to take this medication at the same time every day to help maintain consistent levels of vitamins and iron in your body. Always follow the dosage instructions provided by your healthcare provider for the best results. When taking this high-potency multivitamin with iron, it's best to take it by mouth, usually once daily or as directed by your doctor. It's important to follow the directions on the product package and not take more than the recommended dosage. You can take this medication on an empty stomach 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. It's also important to avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication as they may decrease its effectiveness. If you're taking the delayed-release form or extended-release capsules, swallow them whole and do not crush or chew them. It's important to take this medication regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. Some common side effects of taking this high-potency multivitamin with iron may include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your body gets used to the medication. If these side effects persist or worsen, it's important to contact your doctor or pharmacist. Taking iron may cause your stools to turn black, but this is not harmful. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, and you can also report side effects to the FDA. In Canada, you can call your doctor for medical advice about side effects and report them to Health Canada. It's important to keep high-potency multivitamin with iron out of reach of children, as accidental overdose of iron-containing products can be fatal for children under 6 years old. If you suspect an overdose, seek medical help immediately or contact a poison control center. It's important to talk to your doctor or pharmacist before taking this high-potency multivitamin with iron if you are allergic to any of its ingredients, have any other allergies, or if you have a medical history of iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to inform your doctor if you have vitamin B12 deficiency before taking it. It's also important to discuss with your doctor if you are pregnant or breastfeeding before using this medication. And before having surgery, make sure to inform your doctor or dentist about all the products you are using. When taking high-potency multivitamin, W-iron, 9 mg iron, 400 mcg tablet multivitamins, it's important to be aware of potential drug interactions. This product can decrease the absorption of other drugs, such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as much as possible from your doses of the multivitamin. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. Additionally, this medication may interfere with certain lab tests, so it's important to let lab personnel and all your doctors know that you are taking this drug. Always consult with your doctor or pharmacist before making any changes to your medication regimen. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center right away. In the US, residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed this high-potency multivitamin with iron, it is important not to share it with others. It is essential to keep all medical and lab appointments while taking this medication. Some brands may also contain ingredients such as docusate. If you have any questions about the ingredients in your brand, it is best to ask your doctor or pharmacist. It's important to remember that this product is not a substitute for a proper diet. It is recommended to get your vitamins and minerals from healthy foods. It is important to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you are using this product according to a specific schedule and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's better to just skip the missed one. Take your next dose as usual and do not take double the amount to make up for the missed dose. Make sure to store the high-potency multivitamin tablets at room temperature, away from light and moisture. It's important to keep them out of reach of children and pets. When it comes to disposing of the product, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.